Hello and welcome to the 2020-2021 Employee Benefits Enrollment Meeting for MedSecurity. Over the next 10 to 15 minutes, we're going to be rolling through various benefits that include medical, dental, vision, and COBRA should you no longer be working at MedSecurity. A couple of things to note before we start. This is available to everyone. This is our annual open enrollment period. The coverage goes live on October 1st. The waiting period is based on the Affordable Care Act 12-month look-back period. So make sure you connect with HR to see if you are eligible. And these bullet points towards the bottom of the page are reasons why the IRS says that MedSecurity can change your election, whatever you choose during open enrollment, during the middle of the year. So an example of that would be if you got married, you can change your election to add your spouse if you would like to do that. But these bullet points are reasons you can change what you choose in the middle of the year. The carrier that we're going with going forward is Humana. It's going to be a new carrier for us. We're really excited about it. The plans are as good or better as they have been in the past, and even better, the pricing is better than it has been in the past. You have two different options. You have a base plan that is less expensive. You have a buy-up plan that'll be more expensive. Both of these plans are point of service, which functions just like a PPO plan, meaning you don't need a referral to go see a specialist. All preventative services, mammograms, pap smears, childhood immunizations, colonoscopies over age 50, as long as it's preventative, all freebies in the plan. Your office visits are covered under a copay, $40 and $55 if you're on the base plan, $30 and $60 if you're on a buy-up. Retail clinics and virtual clinics are also on copays, $40 on the base, $35 on the buy-up. The deductible is higher on the base plan, $5,000. The deductible is lower on the buy-up plan, $1,500. After you meet that deductible, which really means you're going into the hospital, you're paying 30 cents on the dollar after the deductible on the base plan. You're paying 20 cents on the dollar after the deductible on the buy-up plan. Anything that says a copay, like urgent care, you don't have to meet your deductible, but when you go into a hospital setting, that's really when you're going to meet your deductible. But for example, if you have a prescription that you need, you have these 4 tiers of prescriptions, 10, 45, 90, and then a 25% copay for the most expensive. Those would be like a specialty drug. Now this has a more favorable prescription drug benefit, which is this. If you have a prescription drug and there's a name brand and a generic equivalent available, Humana is going to force you to go towards the generic, which is what you had in the past. But Humana has this feature called dispense as written. So as long as your doctor says dispense as written and you need the name brand, then Humana will allow for that. So that's a positive feature. Your cost per month will depend on your hourly rate, and that hourly rate is indexed to an Affordable Care Act percentage that bounces around every year in terms of what is considered affordable as defined by the Affordable Care Act. So just contact HR. You'll be able to get your price. But the good news is you will not pay more than $216.14 per month. And even that cost is way better than it has been in the past. So we're really excited to be able to offer these 2 new Humana plans going forward. Couple of tips and rules for engagement. Biggest 2 things are freestanding emergency room and the hospital emergency room. I had a friend who was pregnant at the time, so anytime baby's involved, you got to be careful. She thought she was walking into an urgent care provider, like a doc in a box. She walked into a freestanding emergency room. That is a emergency room outside of a hospital setting. She got saline and a $3,500 bill. And she thought she was going to a doc in a box. She wasn't. She walked into a freestanding emergency room. So be very careful where you go to get treatment. Now, if it's life or limb threatening, then obviously use the brain that you've been given. It's a good one, and go to the emergency room if it's life or limb threatening. A lot of stuff you can really take care of via the virtual doctor. It's called Doctor on Demand. That's the name of the practice that is inside of Humana. You can download an app. I actually have that app. One of my kids got pink eye. I knew that because another kid had pink eye at the time. I called the doctor. They said that's pink eye and prescribed some amoxicillin on the phone. Took me about 15 minutes. It was wonderful. Other than the fact that they had pink eye and I didn't want to get it. So Doctor on Demand is that virtual care doctor 24/7, 365. There's some more information that I'm scrolling through pretty quickly here. These next couple of slides are going to detail a program inside Humana that is no cost to you. It's a health and wellness app. You can download a Go365 app and sign up. We can also help you navigate this because we know that it's new. But the bottom line is, if you just start tracking your steps through the app, yes, we can help make sure you get connected to it. If you just start tracking your steps, then you're going to get points. I just bought a new pair of running shoes, and Humana paid for them because I got points and bucks. They're called Go365 bucks that I use to cash in at Amazon. And so there's all different ways to earn points. But again, for the purpose of this information, you don't need to absorb all of this. We'll be following along with some further information. Education, fitness, prevention, healthy living. You get all these different points for doing different things. So let's see, for example, you're in a sports league, 350 points, and those points all accrue, scrolling backwards a little bit, to get you to silver status, which is 5,000 points. And so we'll be providing some more information because we want you to get some free money as long as it's out there just by, honestly, if you just track what your daily habit is walking around, I bet you can get between 5,000 and 10,000 steps every single day, which is a good thing. And it racks up to some points, which convert to real dollars. You can buy, we've had folks buy gas grills. We've had folks buy gift cards and be the fun cousin at Christmas. That's just a Christmas card for you, Christmas card for you. They're like Oprah, but they use Humana money to do it. Okay, let's talk about your teeth and your eyes, and then we'll be done. Teeth, moving to Humana. We changed the carrier on here. We got as good or better of a benefit and as good or better pricing. Here's how it works. You've got $1,000 annual max. Preventative services, 3 routine cleanings. Those are freebies. When it says 0, that's a good thing. That's covered by the cost of the plan. But if you need a service beyond a preventative service, either coded as basic or major, for example, if you had a cavity and it was $200, this is how the math would work. $200 cavity, you meet your individual deductible one time each year. 200 minus 50 is a $150 bill. You're paying 20 cents on that $150. So you're paying $30. The insurance company just paid $130 or 80% of that $150, and that $130 that they just paid posts against that annual max. So think about the annual max on a dental benefit like a bucket of money that the dental carrier is going to throw at your mouth on an annual basis. Costs are here below. Let's talk about vision. We did make a change there as well. All of these benefits were either, again, as good as they were in the past or better, but the price tags were better. So this is, there's kind of a theme here. So this is the Humana vision policy. The network is called iMed. You pay 10 bucks, go get your exam, and then you can do either or, not both and, either frames or contacts. Frames, you'll get a $130 allowance, and then you'll get some lenses on a copay. If you're really blind like me, you ain't getting out for a $15 copay. I choose to shrink my lenses down just so they fit on my face. So you can either get frames and lenses, or you can get contact lenses, and you get $130 for those. And you do that this once every business means either or. You can't do both at the exact same time. A little bit of information on the network is at the bottom of the page. Prices are also at the bottom. EAP is a freebie to you. I'll explain just a little bit more about that in just a second. Premium only plan simply means that taxes aren't coming out, which is good. So it makes your take home pay go up because you're not paying tax on anything that is included in these benefits. These next 2 pages are EAP. It's called Employee Assistance Program, completely free to you, paid for by MedSecurity. Tons of stuff that they can address: workplace concerns, emotional issues, relational concerns. If your stress level is not higher right now, you probably haven't been paying attention to the fact that COVID's going on, but there's a lot of stress out there. EAP can help with some referral services. We also have some folks that like the legal and financial program, 30-minute consult with a local attorney. Some folks like an online will prep. My mom actually used her EAP for an online will prep. She said it was pretty good. So some more things that you can take a look at on your own time. And the rest of this guide, you may get a little bit dizzy because I'm scrolling through pretty quickly. These are great late night reading material. Great late night reading material. Required notices that we have to let you know about, but we're not going to cover for the sake of time. We're going to end on contact information. Melissa is in the San Antonio office, and then our San Antonio office backs up her as well. Here's all the vendor contact information, our information, and then HR's phone number. Please call us if you have any questions, and thanks for being a part of the MedSecurity team. Y'all have a great day.